We are going to ask each of our moderators to try to sum up in quite a short time. They won't like me for this. We're only giving them 2.5 minutes each to sum up the discussions. But then we want to leave time to have some questions. So please do send questions via Slido, and we will hope to get some of those into our discussion. So who am I going to ask first? Nick Beattie, President of Eurega, that's the European network that represents regional and local health authorities. You were looking at policies for health, Nick. So can you try to sum up in 2.5 minutes? I'm going to be quite strict on that, and then we can have our discussions. Thank you.
Yes, we had a very, very wide-ranging discussion and conversation, as you might expect, with ex-Director General of Sante and a Deputy Director General of Regio. Some key points about practicalities of moving forward. First, the recommendations that we already have hit majority of the points. The question is more around how do we make sure that this stuff actually sticks. There are a lot of changes going on at the European Commission level, which will help us, particularly in terms of shaping programs and funds. But moving this forward is actually a partnership issue. And so there is a need at a national and a regional level to also step up to the table to bring this together in a coherent conversation and a coherent plan to move forward. That in itself is challenging given the sort of diversity of the approaches to health and care at nations and regional level, but that doesn't stop us moving forward. So learning from each other, learning from the experience in the national and international programs that are already there, and a real challenge for us all, how not to lose the rapid pace that we have now achieved during this period of responding to COVID. Maybe not as hectic a pace as we've had to respond to, but making sure that we do continue at a pace and to learn and adopt and implement the innovation and the changes to move to a sustainable position. And final point, a general recognition that perhaps historically we have seen an underfunding in the health agenda in its round, and that this COVID period has recognized that or highlighted that. And perhaps we might see some change at a national level as well, which will allow us to respond to some of the challenges that we know regionally and locally and nationally people have been left with trying to deal with. There was a lot more to it than that, some very, very specific points. Just one final one to pick up, which came in from Paula. There's a lot of noise about why can't we just move, or why do we need more changes in the legitimacy and the legality of settings? There are many things we can do without needing to change legal makeup and the legal setup and the differences of balance of competencies between local, regional, and national. So don't look for the barriers, look for the solutions.
Okay, thank you very much. So yes, you picking up that idea of making an opportunity out of a crisis and potentially having more funding, and we definitely have seen things move more quickly, haven't we? So thank you for that, Nick. Now let's move to Nicole Donshwa, the COSIR Secretary General. That COSIR, if you don't know, you probably do, it's the European Trade Association representing medical imaging, radiotherapy, health, ICT, electromedical industries. So Nicole, 2.5 minutes for you.
Thank you very much, Kathy. In fact, we had a very great panel of speakers. First of all, we had multi-stakeholders when we looked into the first slide. A lot of people coming from different multi-stakeholder, again, not only industry but NGOs, etc. So it was very good. We had, in fact, as I said, high-level speakers also representing multi-stakeholder approaches. We had a keynote from the European Commission, DG Connect, and we had also academic, patient, and industry. We had, in fact, three slides of interesting questions linked to our three recommendations. The first recommendation was on health data space. Yeah, what should be the priority for you? And the big winner among the four choices given is that we need to define a clear data governance framework. 76% of people responding that, and coming just after that, develop and implement common data specification was the second priority, and third priority was again ensure financial viability to the MFF. With regards to the recommendation on interoperability, the big winner was, okay, how do we find the best way to scale up and implement e-health interoperability? And the answer by 81% was by prioritizing implementation that enables cross-border electronic health, the EHR exchange, and also by drawing national strategies and action plans. The third recommendation focusing on AI, artificial intelligence in health, and the question was how can we increase the trust in potential of AI in healthcare? And the big winner was 72% by ensuring strong governance rules on the use of health data driven by public authorities, and also by establishing structural multi-stakeholder dialogue, and also with a strong ethical framework. We had also some questions from the audience towards the end of the session, by which the question was, okay, how can we ensure, that we have implementation and competencies both at a local and regional level? And one issue popped up that was also on the challenge on GDPR interpretation by different governments and stakeholders that are blocking some data share. And I will stop there. Thank you, Kathy.
Very much indeed. So that was digital health and health data. So let's move on to healthcare systems now. Jacqueline Bowman from EASO was the moderator, and obviously EASO represents the European obesity community, and you are the voice of obesity science, medicine, and the community together. I know that it's bringing everybody together, a real partnership. So Jacqueline, tell us what happened in your session on healthcare systems.
Quite a lot, Kathy. What can I say? Because, of course, as we know, regardless of what we do in other pillars, it's actually the systems that are going to feel the burden at the end. So I was delighted to actually welcome MEP Nikolai Stefanuta and also Melita Yakab from WHO to a hard talk, because there were some hard questions to be had, let me put it that way. Now, what we focused on, because of course we had our 5 implementation actions, and if I had to really summarize or synthesize this discussion, it boils down to understanding and incentives. Now, I'll talk a tiny bit, my 2 minutes left of that. So understanding, what we basically saw as a group was that if we're not speaking the same language, both technical, interpreting the various policy text into implementation, we will not be able to transform raw data into usable information that can actually move towards better health outcomes for all. Also related to both understanding and incentives, there was a big discussion for obvious reasons on different kinds of prevention and how to actually optimize health systems so that we work along a continuum based on our alignment on language, whereby somebody's treatment is someone else's primary or secondary prevention. So we felt that generally speaking, and I thought this was a really good comment to make, that the money's not plentiful, let's put it that way. So we need to spend wisely, and we need to look at it as an investment as opposed to who's paying for this, because paying is just money going out the door. Investing actually allows us to co-create with different partners, and that's where we come on to incentives, because where's the incentive to do that? MEP Stefanuta made the very excellent point of subsidiarity. Let's find a win-win, shared value. WHO has a lot of experience on this as well. Shared value both across sectors, so it could be a public-private partnership for a European Observatory on Data and Innovation, and also at local, regional, national, and EU. Because what's missing is a sense of political will to get this done. But political will only takes you so far. Technical committees only take you so far. This is actually about a joined up effort. And so let's just say that our 5 implementation actions, actually a bit of tweaking, but we're definitely on the right track. And yes, we do need a structured entity and probably clusters of the same entity at regional level, at national level, at EU level and beyond. And WHO made a very big point of saying they're ready to collaborate, we're aligned, because we all want to be able to interconnect the data so that it's meaningful and that everyone who can be impacted for better health outcomes and resilient health systems can actually participate and not just be a token.
There we are. Thank you very much indeed, Jacqueline. So now our 4th moderator, Wilfried Elmier, Biomed Alliance President, and the Biomed Alliance brings together European medical societies that represent, I think, something like 400,000 researchers and health professionals, so a huge organization.
Thank you, Kathy. I had the honor and the privilege to join a very exciting breakout session. I think it was very interesting for all participants. And I think one of the key messages probably we can all agree on is that the European Union should be a hub for research and innovation in health in the world. And I would like to talk about 3 points. One is about collaboration, about innovation, not about coordination, if I try to summarize what we have discussed. I think we are not there yet in terms of that we're really the hub for research and innovation, and this was also, there are still areas for improvement, and I think this has also been acknowledged by the European Commission in the recent communication about the new European research area for research and innovation. I mean, there are several reasons for this, but it's not only about funding, just the keyword 3% of the gross domestic product should be spent for research, but it's also the way of how we rethink strategies and what we're actually doing also with the funding. And with respect to collaboration, I think what was really a topic from all the different panelists which we had today is that we need to build on a long-term collaborative ecosystem to support and incentivize the generation of new knowledge transfer, also interdisciplinarity networks, cross-border initiatives, as well as health data infrastructures, public-private partnerships, and so on. So this is something which is really important, it's the collaboration. It's not only collaboration, I think that was also an important point, geographic collaboration, but it's also collaboration among different stakeholders, about health providers, clinical researchers, about regulators. I think this is something the COVID-19 crisis showed, actually, that we also have to rethink a little bit the way we are doing clinical trials. The second point I would like to make was about innovation. I think this is also really highlighted that in Europe we do very excellent research, we do good research, but somehow that we are losing a little bit the battle of innovation compared to other countries. So this is something one has to take into consideration when we think about the whole ecosystem of research within Europe. So there has to be some initiatives, and also there are new PPP models, new business models, and collaboration between these different stakeholders also to promote innovation. And finally, I think another important issue which was actually always raised is about coordination. I think it's about coordination about these different levels we have. I think there are great instruments in place across the European Union, starting from Horizon Europe, EU for Health, public-private partnerships, the new IMIs, and so on, also the pharmaceutical strategy. But somehow we need an instrument or we need a kind of a mechanism to link all these different initiatives we have and funding possibilities we have. And then we also was heavily discussed whether this new biomedical research and development agency, which is proposed now to be established next year, whether this agency could provide this kind of structure which brings together all these different players, all these different funding instruments, starting from basic translational research to clinical research to innovation, so that we don't work all in silos, but rather have a kind of continuation and interaction between these different structures, which are all required in order to bring at the end drugs to the patient, right? So medication to the patients, yes.
In some sense, you want to see some sort of simplification, bringing things together and
yes, bringing things together, providing a long-term structure, providing a long-term perspective. I think now we all understand, for instance, with BARDA, why it was established, because there was political and health issues which are emerging, of course, and which are important. But somehow we had also the feeling in the panel that there might be now an opportunity by establishing such an agency that we can also bring other aspects, long-term aspects. I mean, now it's a COVID crisis, but in a way, there are other chronic diseases, which is an important health issue. There's unmet medical needs, there are non-communicable diseases. And for a patient, this is, of course, very, very important, right? If you think it from that perspective. So we also have to do something about this. So we need to have instruments where we can react quickly on emerging threats, but at the same time also instruments where we have a kind of a long-term perspective.
There's a question coming here. Maybe I put this to you, Nick, but anyone can come in. But it says that as regulations are always, unfortunately, following the technological progresses, what are EU deadlines defined to make e-health, e-health action, health aid a success? My fear is that if we have no strong framework, we will remain in a grey zone. So it's sort of the idea that it's all. I mean, you suggested things were speeding up, but this questioner is thinking that's not necessarily the case.
Yes.
Exactly. Just Nick.
I think it is challenge. One of the risks, I guess, is that if we all speed up, but we don't have a common reference framework or a common standard or a common strategy, we may be speeding in different directions. And one of the things that was very, very clear, and I think Nicole highlighted it as well, being able to share the data, particularly share the information and be able to act collectively is important. I think it's really picking up one of the key priorities. The local strategies for investment will all change, will all vary, and will move at different paces. The importance, particularly in terms of getting the EU and European and national strategies aligned, is how do we intercommunicate, interconnect, interoperate. A lot of three words thrown in together there, but it really is not about standardizing a strategy for all areas, but standardizing on the key bits that are important to allow us to operate as we go forward.
To build on that, because that came up a lot within our group. The basic issue, and I think you hit the nail on the head as well, Nick, by saying, rushing is not necessary. Rushing into just action anywhere, just for the sake of, is not going to work. The suggestion from our group, and actually you can look at how the EU health data space is going on that front as well, is to actually align firstly on common values, on the language, and we're talking vocabulary here, because what a particular word means for one stakeholder actually means something completely different to somebody else because of usage. And we're definitely seeing that within the world of obesity, so that, for instance, everyone talks about BMI as a definition of obesity. It's not. Let me put it that way. So yeah, it's things as basic as that, because once you actually start pushing in wording, and then you build strategies and performance matrices and all kinds of things around that, if you actually are not speaking, if you don't have the same vocabulary in definition and scope in the first place, you're going to run into a lot of problems. So that was actually one of the big outcomes from our group discussion as well, and I think it fits in here. And in other fora, I've been having the same discussion on the EU health data space as well, because actually there are a lot of assumptions that people know what this is about.
bring Nicole in on the whole issue of the health data space, because, I mean, obviously this is going to be published as a legislative proposal at the end of next year. And you talked about needing a sort of a particular governance framework. But, I mean, what do we really need to make that happen? And what difference would it make if we had a functioning health data space? What difference would it make?
Yes, Kathy, first of all, on your question, do we need regulation? Again, you're right. Let's say for the European health data space, it's a big priority for everyone. On the other hand, we need smart regulations, yeah? So what does it mean? Look, the example of GDPR, it is a regulation, but it is full of compromises, and then people are a little bit challenged, you know, on how to implement a GDPR at the country level, you know. So what we need on the health data space, and as it was obvious through our conversation, is that we need a data governance framework. What does it mean? That means public authorities need to first work together, you know, on the best way to exchange health data and to have, let's say, a governance in such a way that we can optimize the use of those data. We see the case of COVID-19 today, you know, where unfortunately countries work on their own, you know, and it's difficult to compare apples with bananas and so on. So, but I believe member states, what does it mean concretely? Is that member states need to work hand by hand together with the European Commission and to have this top-down approach, but without also forgetting, you know, the bottom-up approach by which they needed to listen to also the stakeholders such as patient organization, researchers, academic, and industry. Yeah, I hope I answered your question.
And somebody here is asking about whether you discussed the minimal investment required for the EU to put in place the right data infrastructure. I mean, did anyone get talking about financial elements of it? Jacqueline?
Maybe if you allow me just, and then I will cut my microphone. In terms of funding, there are multiple funding mechanisms. So you don't have only one. You know, you have Horizon Europe, you have Digital Health Europe, you have cohesion funds. So there are different pockets of money. On the other hand, because of COVID-19, we see that the money put on the health program is diminishing, which is a little bit, you know, not surprising in such a pandemic environment. At the end of the day, we need also to ensure that startups and you know industries have also the bandwidth to continue and not to die, let's say. But it's not only a matter of money, and there are different pockets, and not everyone is aware of that. Sorry. Thank you.
Let me just move on to another subject in terms of we're talking about needing the partnership between Europe and regions and local authorities. Do you get the sense that the COVID crisis is going to change the willingness of national governments and regional governments to perhaps let go a little bit of the reins on health? You know, there's always been this resistance at national level to allow too much to happen at European level. But are we now seeing that change? I mean, what do you think, Wilfried?
I hope so, that the member states see that actually that health is not only a national priority, it's a European-wide priority, right? The virus doesn't stop at borders. I mean, it just passes. So, and I think that also gives a reflection that we need collaboration, we need interaction, we need coordination across Europe. I think probably every member state at the moment had calls for acute research on COVID-19, and probably at the moment, many things are done at the same time within Europe. And we could always ask whether it would be better to at least part of this financial means to use for coordinative approaches or to interaction. I think it's much better. I think we can only be competitive and can only develop treatments, understand biology, understand disease biology, develop treatment options if we work together. I think we are too small as an individual country to really tackle complex diseases. So we need interaction. And hopefully this just shows because it's an emerging threat, right? It's a viral disease, it's an infectious disease, but in a way, also other chronic diseases are a threat for the European population. It's not communicable, it's not contagious, but still many people across Europe are affected by this. And I think similar to infectious diseases where we have to work together, I think we also have to work together on other areas. So hopefully, yes, there will be a change now of how national members see health or health research, hopefully.
Jacqueline?
And this is a really important point because from an EU policy level, a lot has been made of value-based healthcare, outcomes-based healthcare. That is about better health outcomes for real people living in real places. It's not so much about what we decide to do in Brussels. And that was a point that very much came out from our MEP as well, basically saying that political, there are different levels of engagement, and it needs to come from both political will at the EU as well as national level and beyond, as well as, if you like, a grassroots. And I think that so far our conversation, possibly because we're all based in Brussels on the panel, but so far our conversation is very much, oh, well, this is only about the money for EU for Health. But actually, if you follow the money, a lot of it was reallocated into the regions and at national level, but the actual pot didn't go down that much. So when you're looking at outcomes-based healthcare in our group, we all agreed you've just got to be creative and actually not look at who's paying for this, but it's an investment. So yes, it's an extremely unfortunate situation in terms of EU for Health and also just the whole research piece, but it actually, as we said in a position paper, it actually gives pause for thought to say, how do we really achieve value-based healthcare and outcomes-based healthcare?
Well, I'm sure that the EU for Health issue will be brought up in our conversations a bit later on. What about the idea of weaving in health perspectives into all policies? I don't know if you've got any thoughts on that, Nick. So that we can really get this sense of equality for the future, and it's really considered to be a kind of a key part of every decision. How practical is that?
Definitely practical. It does need a mindset shift in many areas, and it's not going to happen overnight. But there are some practical examples of how to do that ourselves. For example, my region in Wales, we have the Future Generations Act, which actually enforces and requires local or public bodies to be thinking about what the impact is on future generations. It embeds health in there. It's not been easy. It does take time. And being able to get people to understand how it works is important. One of the things I think that sometimes clouds the debate is making a distinction between health and well-being of individuals, which is partly what the health in all policies is about, and health system. And definitely some of the stuff that Jacqueline was talking about in terms of value-based healthcare is starting to look at a whole system approach, not just the health system, the delivery of health services, but what does that overall impact look like? And that's when you start moving into those the overall determinants of health. So not just health system and health, but what are we doing in terms of housing? What are we doing in terms of environment? And starting to shift the debate. There are lots of people who can make a difference in the health agenda. The health and well-being agenda is not just a health system one, and it's not just a political one. And that really talks to some of the points we were talking about earlier about partnerships, working with other sectors, working with the economic dimension, working with the innovation dimension, not just staying in our sort of narrow historical mindset. So whilst a lot of people will be saying, oh, it's almost impossible to get help in all policies, it can't work. It can, and it can in many policies, it makes a lot of sense. Embedding health messages into education curricula, that doesn't take a lot of cash. It just takes a bit of effort and mindset, but it starts to change the thinking of future generations.
Okay, thank you very much indeed. And does anyone, somebody has asked a question about what European options are there in the field of elderly care, an enormous challenge going forward. Anyone have any thoughts on that? It's not anything not necessarily anything that you came up in any of your discussions.
Not necessarily directly in our discussions, but it is something that I think at a European level there is quite a lot of attention already. We've put a lot of effort into the European Innovation Partnership for Active and Healthy Aging. There are lots of examples of how to do that. For me, the challenge is how to take what we've done so far and continue to scale it and make it operational on a more pervasive and widespread basis, and indeed to start to learn from some of the lessons we've had in that space and embed it into other sectors, other population sectors, or other ways of service delivery. One of the challenges has been if you just segment into elderly care, that sometimes excludes other aspects which are locally organised. I think the challenge is, just to throw one in, that we do have elderly, but also other sectors, and it walks us back into the data space. We have this huge plethora of the use of new technology and use of new technology locally. So one of the biggest shifts that we've seen for individuals is this growth in being able to use video conferencing and devices. So we now have an expectation. We have an expectation from many individuals that digital part of the solution in terms of delivering services and care for elderly, but for everyone else. And I think even with the changes we've seen, we've still got a challenge to make our systems catch up.
Okay, well, in fact, I'm sorry, but we have actually run out of time on this session. I know that wasn't a lot of time for discussion, but I know that some of your action plans are going to be put to paper, and so we will get some sense of what your discussions are overall. So thank you all very much indeed to our 4 moderators and for your questions.
Okay. Thank you.
Bye-bye. Yes, thank you.